everyone, and welcome to Session 3 of the Global Black Feminist Reading Circle. My name is Randie Henderson, and I am one of the Black Feminist Reading Circle members of this online group. This session runs from January 20th until June 2nd and includes 2 week-long breaks. Our democratically selected reading material is Harriet A. Washington's book, Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times to the Present. Our book group meets each Tuesday evening from 6:30 to 8 on the Google Plus Hangouts on Air platform. You may find the Global Black Feminist Reader Circle on Google Plus, YouTube, and Facebook, and always feel free to join us in reading our story together.
Good evening. My name is Venita Walker. I'm joining tonight's meeting from Cromwell, Connecticut. Glad to have you all here.
And I'm Kim Brandon. I'm from Brooklyn, New York.
My name is Georgette Moses, and I'm watching and participating from Columbia, South Carolina. And I am so glad to see everybody, or almost everybody, back here despite sickness and trials and tribulations. And I'm excited to start this new chapter in our reading experience.
Randie Henderson, as mentioned in our welcome, and I am watching from Atlanta, and I miss everybody very much. I'm excited about this book.
And I am Michelle Odom. I am here in New York City. I'm one of the co-hosts of the book group, along with Randie Henderson. And tonight I am facilitating our launch of Session 3. We're going to focus on the introduction, which is called The American Janus of Medicine and Race. Janus, you know, I kind of figured it meant beginning, but that's one of the words that I had to go to the dictionary over. And actually what it means is the Roman god of doors and gateways, hence the beginning. So let's look at the summary.
In the introduction, author Harriet A. Washington cracks open the door on the journey she will guide us on, offering glimpses of the people and scenes we will witness behind the deafening silence. She outlines the book as follows. Medical Apartheid consists of 15 chapters organized into 3 parts. Part 1, A Troubling Tradition, takes a chronological approach to the role of African Americans in early American medicine. It stresses the experimental abuse and exploitation of African Americans from the first encounters in the New World through the post-Civil War era and then up until the Tuskegee syphilis study, which began in 1932. Part 2, The Usual Subjects, covers the period from the early 20th century to the present day in a roughly chronological manner. However, it departs from strict chronology in favor of an analysis of specific types of vulnerable subjects, children, soldiers, and hospital patients, used in research conducted by institutions ranging from the federal government to private corporations. Part 3, Race, Technology, and Medicine, examines contemporary research issues, including genetic research, investigations into emerging diseases, and bioterrorism. In the epilogue, Medical Research with Blacks Today, I discuss how the worst abuses have been replaced by more subtle threats to the rights of the individual to choose whether and when to participate in medical research. Finally, the appendix directs readers to a wealth of guidelines and regulations to help them navigate clinical trials.
Washington confidently asserts Black Americans do not need me or anyone else to inoculate of fear of medicine. Medical history and practices have long since done so. Medical apartheid is my attempt to document at long last and as fully as possible how and why this has happened. Washington is not a medical doctor and uses part of this chapter to share her credentials earned in various aspects of the field and how that experience led her to do this work. She also shares the resistance she encountered about writing this book from some doctors. Washington notes that this book is about the African American experience and makes no attempt to document the abuse of Black people by medical research industry around the world. Thus, she opens with a lens on J. Merriam Sims, MD, a surgeon who practiced medicine in the 1800s, and goes on to offer disparate health indicators between Black and whites that persist to this day. Disparate, beg your pardon. While also giving us a view of breadth, and depth of the kinds of abuses we have learned more about in the areas of medical research, and leading us to more comprehensive treatment of specific incidents. Ultimately, she defines medical apartheid this way. The much bewailed racial health gap is not a gap, but a pronounce that word,
chasm.
Wider and deeper than a mass grave. This gulf has riven our nation so dramatically that it appears as if we are considering the health profiles of people in two different countries. A medical apartheid.
Point C, I'll read that one. Health disparities are the civil rights issue of the 21st century, said Donna Christian-Christensen, MD, then chair of the Congressional Black Caucus Health Brain Trust. Yet, mounting evidence of the racial health divide confronts us everywhere we look, from double Black infant death rates to African American life expectancy that falls years behind whites. Do you see any evidence that the racial health divide is being addressed in any meaningful way? Anybody?
Well, I don't know. I haven't had a lot of family members who have been deathly ill. My grandmother had breast cancer, and she chose not to be treated. And cancer, as everyone knows, does not wait for you. So it just, it ended up consuming her whole body. My grandfather, who was drafted in Vietnam, was actually, they tested some drug on the men during that time, during the boys that were drafted, and he was an orphan, so he was drafted first. He couldn't afford to not be drafted, and he was Black. But
was it Agent Orange?
I'm not sure. I have to ask him. I don't want to tell you wrong, but he got it, and it caused him to have prostate cancer, and it was paid for, I guess, as a reparation, and he was able to be treated for it, and they froze it, and they were able to freeze it where it was and take it out. So, as opposed to him not being able to get treated, but he's also a middle class Black man, so I'm sure that story would not have been the same had he been poor, so, or had he not gone to the war. So I'm not sure. I'm sure it changes based off of class.
Yeah, to some there's some class benefit. Yeah.
A lot of class benefit even today among Blacks. I do find it has changed somewhat because we have also made some changes ourselves in prevention of a lot of diseases, like high blood pressure, diabetes, obesity. So I think the changes have been because now we're educating ourselves more. We're starting to educate the little people, starting from preschool, nursery school, how to have better health, how to exercise, how to eat properly. Because let's face it, a lot of things you can't blame on the lack of medical care. A lot of it is prevention. And anyone who lives in the southern states knows about some of the problems that they're faced with there, such as Georgia, good example. The obesity rate, which comes from also, not proper diet, or should I say eating the wrong foods, which in turn causes diabetes and high blood pressure and all kinds of other things. So I think there's advances because we've decided that we are taking control and we are now trying to have better habits to try to prevent some of the diseases that we all know that we are more susceptible to get or to have. So that's the change I see, not necessarily because of our society. It's because we're trying to live differently to prevent it. So we don't have to go to doctors as much and be at the mercy of them.
Yeah, well, I guess, you and I are probably going to be at odds throughout this reading, because I still would say there's some class benefit, but I think it's pushing it to I think it's naive to think that there's a lot of benefit, because one of the things that she is demonstrating. See, this is not a book about whether or not you take good care of yourself and whether or not you do average things to be knowledgeable about, your own health. This is a book about what is done, what has been done, and is being done to us without our knowledge, without our consent, without our being asked to understand the risk that we are exposed to in the name of medical science. And so while it's certainly true that poor people have then and have now more to be concerned about, that's not the whole story. Like, one of the things that I just recently read about in one of the later chapters is the way the whole sickle cell anemia scare played out. I think this was mostly in the 70s, and it really wasn't about class. It really was about color. So I don't want people to have any undue fear. And one thing that Harriet Washington reiterates throughout the book is the necessity of medical research, and that we ought to be trying to find ways to participate in ethical research, particularly around conditions that afflict Black people more than others. But but those ethics have been very, very slippery, and so I don't want any of us to have an unreasonable fear, but I also don't want us to have an unreasonable innocence or naivete, because I think if we're going to figure out how to protect ourselves, we're going to have to be honest about the very real threat that is there for all of us. Which really is kind of this last question, which is, but historically, most perpetrators of ethically troubling experiments utilizing African Americans have been overachieving adepts with sterling reputations, impressive credentials, and social skills sufficient to secure positions of great responsibility. And so my question was, is this surprising? Why or why not? But I think that is just the thing, that you know, we may feel some protection because we're going to a doctor with the best credentials, you know, who graduated from the best schools, who is practicing at the best institutions. And so we may feel a false sense of security because of those external identifiers. But what she is saying to us is, it is those very doctors and it is those very institutions that we are most likely to put our most trust in that have been the perpetrators of, you know, just some of the most dastardly deeds imaginable. So, you know, I'm going to say it. You know, I'm going to say it every week. I'm going to say it over and over. I don't want us to be unnecessarily fearful, but I also don't want us to be, you know, too naive about what's going on here, because it's difficult. It's difficult to believe that some of these things have happened and are happening, and so I believe our instinct is going to be to try to clean it up, to make it nicer, to tell ourselves that, oh, you know, that's what happened 100 years ago, but we're not there anymore. But I'm going to stick with Harriet Washington, who is telling us we are still there. You know, we may not still be there to the same degree, but we're still there. I mean, one of the last points was about the difference in our lifespans. You know, just every category, and that's what she goes into in quite a bit of detail in the introduction. But just every category of health you can imagine, we are doing dramatically poorer than white people. And yes, some of it has to do with our own behavior, but some of it also has to do with what is being done to us, like not getting the access to the most beneficial medicines and technology. You know, that's what's happening current day. Whether you're knowledgeable or not, whether you are middle class or high class or not, you know, we're not controlling the whole scene here. So we need to bear that in mind.